Is SIRS the same thing as sepsis? No. SIRS is an acronym that stands for Systemic Inflammatory Response Syndrome. Now, the sepsis definition has been revised many times. And initially, one of the tools that was used to screen for sepsis was called SIRS, and it was used to define what sepsis is. And that looked at 4 different things, everything from temperature to heart rate to respiratory rate to white blood cell count. And the problem with SIRS is that you can have a fast heart rate and a fast respiratory rate and not have an infection. You might actually be withdrawing from drugs, for example. Alcohol withdrawal can give you tachycardia and tachypnea, and a lot of other substance withdrawals or intoxications can give you that. So it's really important to understand that systemic inflammatory response syndrome, or SIRS, has really fallen out of favor in terms of defining sepsis. It's still a challenge to find an easy way to explain and define sepsis, I think. And a lot of that has to do with the fact that even saying that someone has an infection with absolute certainty can be difficult. We don't always isolate the source of infection. In fact, that article I shared in my last post shows that 40% of the time, there's no pathogen found to explain where the infection is coming from. But remember, SIRS is not sepsis.